Hi, my name is Maya. I'm a first semester nursing student at UTEP. I'm going to be performing a head-to-toe assessment on you today. It's Crystal Echeverria?
Yes.
Okay, do you have a preference on how you go by?
Crystal's okay.
Crystal's okay? Okay, cool. So with the head-to-toe assessment, pretty much I'm going to be reviewing your physical state and functions of all your body systems today. Is that okay with you?
Yes.
Okay, cool. And is the room okay? Do you need more privacy? Room change?
No, I'm comfortable.
Okay, cool. Just going to close the curtain. Hand hygiene. Okay, can I just see your wristband, please? Thank you. Can you just confirm, or can you set your date of birth and your full name for me, please?
Crystal Chavarria, February 19, 2002.
Okay, cool, thank you. You can go ahead and put your arm down for me. Alrighty. I'm just gonna ask you a couple of questions to start off, okay?
Okay.
Do you have any latex allergies?
No, I don't.
Any food allergies?
No.
Okay, any environmental allergies?
No.
Okay. Do you have any medicine allergies?
No.
No? Okay. Alrighty. So can you just give me your first and last name for me one more time?
Crystal Chavarria.
Okay. And then do you know where you are?
I'm at UMC.
Okay. And do you know what date is?
June 13 to 2021.
Okay. And do you know who the current president is of the United States?
Joe Biden.
Okay, cool. Thank you. So the patient is awake and alert and oriented ×4. The patient also seems to be well kept, in good appearance, and they look their stated age as well. Alrighty, so I'm just gonna go ahead and take some vitals. Is that okay? Okay. Does that feel snug?
Yeah, that's
okay.
good.
So I'm gonna be taking your blood pressure first, okay? I'm just gonna pretend I have an alcohol wipe to clean it before I put it on the patient. Okay. Alrighty, your blood pressure is 122 over 80, okay?
Okay.
Good. Okay, I'm just gonna be assessing for your heart rate as well, okay?
Okay.
Okay, so the patient's heart rate is 70 beats per minute and the respirations rate was 16. Okay, so I'm gonna go ahead and assess your skin, hair, and nails next, okay?
Okay.
So I noticed no tattoos on the patient. Do you have any changes in your skin lately?
No.
Do you notice any mole changes as well?
No, everything's normal.
No? Okay, I do notice some moles on the patient, but the patient states that there's been no changes in them over the time. There's also no signs of primary or secondary lesions on the patient as well. No wounds or no bleeding, no visible bleeding. Okay, and then I'm gonna go ahead and check for tenting. No tenting, the patient is not dehydrated, their skin is hydrated. I'm gonna go ahead and palpate. Okay, patient's skin seems normal and there's no noted signs of dryness. Okay, I'm gonna go ahead and assess for the patient's capillary refill. Okay, capillary refill is intact. It was less than 3 seconds. Okay, and the temperature of the skin is normal as well. Okay, I'm gonna go ahead and assess your hair. Is that okay with you? Okay, cool. So I'm just gonna go ahead and put on some gloves, and as I'm looking at the patient, her head is symmetrical and it's also normal cephalical. I'm gonna go ahead and assess her head and palpate her head as well, and also look for any signs of pediculosis. Okay. Hair is good strength, good colors. Hair seems healthy, and I see no signs of visible pediculosis on the patient. Okay, I'm gonna go ahead and assess for clubbing now. If you can go ahead and put your fingers like this for me, please. There you go. Thank you. Okay, there's no visible signs of clubbing, and the nails are at a 160-degree angle, which is normal, okay? Alrighty, so I'm gonna ask you a couple more questions. Do you have any problems with your vision or hearing?
No.
No? Do you wear any glasses or corrective lenses?
I wear contacts.
You wear contacts, and how long have you been wearing contacts?
For about 4 years.
4 years? Okay, cool. I'm gonna go ahead. The patient looks like their ears are symmetrical. Piercings are noted on the patient, bilateral. I'm gonna go ahead and assess the ears now as well. There's no visible signs of draining or cerumen buildup on the patient. There's no lesions, scarring, or wounds. The patient's ear color looks normal, and the tympanic membrane also looks like it's a gray pearly color as well. So ear pretty much is normal. Alrighty, I'm gonna go ahead and perform a test on you. It's called the whisper test. Okay, I'm gonna perform the whisper test on you now, okay?
I love Gizmo.
I love you, Deb.
I love you, Ted.
Okay, thank you. So the patient was able to perform the whisper test successfully. Alrighty, I'm gonna go ahead and assess your eyes now. Is that okay with you?
Yes.
Okay, I'm gonna go ahead and do hand hygiene again, and also put on a new pair of gloves as well. I'm gonna go ahead and assess for the conjunctiva now of the patient. Alrighty. You can look up for me. Thank you. You can look down for me. Thank you. So the bulbar and the palpebral conjunctiva is pinked and moist of the patient. Alright. Okay, I'm going to go ahead and perform another an eye test on you now, okay? Alright, so if you can just go ahead and stare at my pen for me, just go ahead and follow the pen with your eyes, try not to move your head, okay?
Okay.
Okay, thank you. I'm going to go ahead and if you can just stare at the pen one more time. And one more time. Thank you. Alrighty, and then I'm gonna go ahead and check for your pupils. Okay, so pupils are 3 millimeters. They're equal and they react to light equally, directive and indirective. Patient was able to perform the corneal light reflex. Both of them are symmetrical. And patient was also able to perform the cardinal fields of gaze successfully. I'm gonna do one more test on you, okay?
Mm-hmm.
So if you can just go ahead and stare at my pen for me, and then can you look at an object behind me? Or on the wall, I'm sorry, I can look at the TV, yeah, fine. And then one more time at my pen, and then one more time behind me. Okay, thank you. Okay, so patella and eyes converge bilaterally with the patient. The patient is able to focus on near and far objects successfully. The sclera is also white. The iris is round and brown. And no lesions or drainage are noted with the patient. Okay. I'm gonna go ahead and look at your tongue. If you can just open your mouth for me, please. Thank you. Stick your tongue out for me. Thank you. The tongue has no lesions. So if you can open your mouth for me one more time. Open your mouth wide for me. Thank you. The tonsils, there's no drainage, no swellings from the tonsils or the mouth. I'm just gonna go ahead and assess your nose really fast. Okay, if you can look up for me, please. Thank you. No deviated septum noted with the patient. All right, I'm just gonna do a test on you really fast. I'm gonna go ahead and test for T and J. Okay, you can just open your jaw for me, please, and close it for me. Thank you. Okay, so no carpitis was found, and there was no issues with resistance with the patient. All right, I'm gonna do another test on you. It's gonna be a taste and smell test, okay? Have you had any issues with your sense of smell or anything?
No.
No? Okay, have you had any issues with your taste?
No.
Alrighty, have you had any issues swallowing?
No.
Okay. We'll go ahead and start this one. Okay, if you can go ahead and drink this for me and tell me if it's sweet or sour.
Sour.
Okay. Thank you. Go ahead and take a spin of this one. Okay, can you tell me if it's sweet or sour?
Sweet.
Okay. And then one more. If you can just close your eyes for me, please. I'm gonna go ahead and have you smell something for me, okay? Okay, what do you smell?
Alcohol white?
Yes, thank you. Okay, patient seems to have no difficulty smelling or tasting items. So for your overall eyes, ears, nose, and mouth and throat assessment, I found no abnormalities. There's no nystagmus, jaundice, or strabismus noted with you, okay?
Okay.
Alright, so like I said, I'm gonna go ahead and assess for the neck. I'm gonna assess for the range of motion of your neck. If you can just go to the side for me, and the other side, back, front, and then do a roll of neck, please. Okay, thank you. And then if you could just look up for me, please. Thank you. So I'm assessing the trachea. There's no tracheal deviation. It is midline, and I see no signs of goiter on the patient as well. Okay, I'm gonna go ahead and palpate some of your lymph nodes. Is that okay? Okay, I'm gonna go ahead and palpate your lymph nodes. Is that okay?
Yes.
Okay. I'm gonna go ahead and start with your preauricular. Is there any pain?
No.
Okay. Your postauricular. Is there any pain?
No.
No? Okay. Is there any pain on your tonsillar? No. Is there any pain here on your occipital?
No.
Okay. Is there any pain on your submandibular?
No.
No. Is there any pain on the submental?
No.
No? Okay. Is there any pain here?
No.
No. This is gonna be your anterior lymph nodes. Anterior cervical, I'm sorry.
Yeah.
Is there any pain here?
No.
It's gonna be your deep cervical. Is there any pain here?
No.
Okay, this is gonna be your posterior cervical. Is there any pain here?
No.
It's gonna be your clavicular. Is there any pain here?
No.
It's gonna be your infraclavicular, okay? So no pain noted with the patient. Alrighty, I'm gonna go ahead and ask you Anything about your things about your respiratory? Do you have any shortness of breath?
No.
No. Do you have any problems like frequent colds or coughs?
Mm-mm.
No? Okay. So patient noted no shortness of breath or cold coughs. Okay, as I'm assessing the patient, I noticed that their AP lateral ratio is 1:2. There's no barrel chest node on the patient, no concave or flail chest node on the patient. Alright, I'm gonna go ahead and also take your anterior posterior lung test. Is that okay with you? Okay. Alright, so what I'm gonna have you take a deep breath for me, okay? Okay, can you take a deep breath for me? Good. Another deep breath for me. Good. Another deep breath for me. Good. Another deep breath for me. Good. You can go ahead and lift your arms up for me. Okay, take a deep breath for me. Thank you. Take a deep breath for me. Thank you. Okay, take a deep breath for me. Thank you. Take a deep breath for me. Thank you. Just go under your shirt, okay? Now take a deep breath for me. Thank you. Take a deep breath for me. Okay, thank you. Okay, now noted adventitious breath sound of the patient. Okay, do you have any chest pain? No. Do you have any palpitations? Have you had a history of a heart attack?
No.
Or family history of heart attacks?
No.
No? Okay. I'm gonna go ahead and assess for your chest expansion. Is that okay?
That's okay.
Okay. Just gonna go ahead and do it on your back, okay? Okay, can you breathe in for me? Okay, one more time. Okay, thank you. Chest expansion seems symmetrical. Alrighty. I'm gonna go ahead and palpate your apical and carotid pulses. Is that okay with you? Okay. I'm gonna go ahead and carotid pulse +2. I'm gonna go ahead and assess your apical. If you can just lift your breast up for me, please.
Did you want me to?
You can just lift up your shirt a little bit. Thank you. Okay, thank you. Okay, the patient's apical and carotid pulses were +2, which is normal. I'm gonna go ahead and also tweet your heart landmarks, okay? I'm gonna go ahead and assess for your aortic. This is gonna be right second intercostal space along the sternum. It's gonna be your pulmonic. This is gonna be left second intercostal space opposite from your aortic. This is gonna be your Erb's point. It's gonna be it's gonna be the third intercostal space along the sternal border again. There's no murmur noted with the patient. Gonna be your tricuspid. You did under your shirt? Thank you. Stay right here. This is gonna be the fourth intercostal space along the sternal border again, the tricuspid. And then I have your mitral, your apical, your point of maximum impulse. Thank you. Okay, when I was assessing the mitral heart landmark, which is the fifth intercostal space, left midclavicular line, S1 and S2 are present for the patient. For the aortic and the pulmonic, S2 is greater than S1, and for the Erb's point, S1 is equal to S2. And for the tricuspid and mitral, for the tricuspid, S1 was greater than S2. Okay. Have you noticed any swelling in your extremities, your peripheral extremities? No.
No.
No. Have you had As I'm assessing the patient for edema on her upper and lower limbs, I notice, can I go ahead and hold please?
That's fine.
I notice no edema present with the patient. There's no redness within the patient. I'm gonna go ahead and palpate some of your pulses. Is that okay?
That's fine.
Okay. I'm gonna go ahead and assess your brachial pulse. I'm sorry, not assess. Palpate your brachial pulse. Thank you. Okay, I'm gonna assess your radial. Okay, thank you. And your pedal, if you can. Thank you. Okay, thank you.
You're welcome.
Okay, so like I said, patient has no edema, noticeable edema, and all the pulses were normal. Do you have any changes in your dietary habits recently? Can you give me like a 24-hour recall of your diet within the past day?
For breakfast, I had toast with a banana. For lunch, I had a sandwich, and for dinner, I had chicken and rice.
Okay, cool. Thank you. Okay, and have you noticed any changes in your bowels?
No.
No? Okay, no issues with like constipation, diarrhea, anything like that? Normal stools?
Yes, no.
Okay, and then any changes in your urinary patterns?
No, everything seems normal.
No, you haven't like had to, you haven't seen an increase or decrease in urination, or you have been using the restroom more at night lately? No? Okay.
No, everything seems about right.
Okay. Alright, so if I can go ahead and have you lay right here, I'm gonna go ahead and listen to your bowel sounds. Okay, I'm gonna go ahead and also pay for your bowel sounds, okay? Is it okay if I lift this up a little bit?
That's
okay.
fine.
I'm gonna go ahead and start at the right lower quadrant. Okay, and the right upper quadrant. Okay, and the left upper quadrant. And then the left, sorry, the
You're
left
okay.
lower quadrant. Okay, thank you. Okay, the bowel sounds of the patient were normal. Alrighty, I'm gonna go ahead and do light palpation first on you, starting at the right lower quadrant. Do you feel any pain?
No.
No? Okay, I'm gonna go to the right upper quadrant. Any pain? No? Okay, the left upper quadrant. Any pain? No? Okay, and the left upper quadrant and then the left lower quadrant. Any pain?
No.
No? Okay, I'm gonna go ahead and perform deep palpation on you now, okay? On the right lower quadrant again. Any pain?
No.
No? Okay. Any pain on the right upper quadrant? No? Okay. Any pain on the left upper quadrant? No? Okay. And then any pain on the left lower quadrant? No? Okay. Thank you. That's for your abdomen, okay? I'm gonna go ahead and start at the right lower quadrant. Any pain? No? Okay. Any pain? No? Okay, that's gonna be your right upper quadrant or your left upper quadrant. Any pain? No? No? Okay. Now I'm gonna be at the left lower quadrant. Any pain?
No.
Okay. Sounds are tympanic on the abdomen. I'm gonna go ahead and percuss for the patient's costovertebral angle. If you can go ahead and sit up for me, please. Thank you. I'm gonna assess for the patient's CVA. Any pain?
No.
No? Any pain? No? Okay, thank you. No pain noted on the patient's CVA. Okay, you can go ahead and sit normally for me. Thank you. Actually, I'm sorry, can you sit up for
Yes.
me? Thank you, sorry. Okay, are you having any trouble walking?
No.
No? Do you experience any joint pain?
No.
Or do you experience any joint weaknesses, muscle weaknesses, stuff like that?
No.
No? Okay, and then are you having any difficulties with your activity, active daily livings?
No.
No? Okay. I'm just gonna ask you for a favor. You can go ahead and sign up for me and just walk across the room and then walk back, please. Okay, thank you. I assess the gait of the patient. No swaying noted with the patient. You can go ahead and have a seat for me. Thank you. Okay, Okay, I'm gonna go ahead and assess for your muscle strength. Okay, I'm gonna go ahead and I'm gonna assess your upper muscle strength first. I'm gonna go ahead, if you can just put pressure up. Thank you. And down. Thank you. Up. Down. Thank you. Up. Okay. Thank you. Up. Thank you. Down. Thank you. Down. Thank you. Okay, no difficulties noted with the patient for the upper muscle strain. I'm going to go ahead and assess your lower. I can see your calf, please. Thank you. Okay, up. Thank you. Down. Okay, up. Okay, down. Thank you. No difficulties noted as well for the lower muscle strain. Alright, I'm going to go ahead and assess your range of motion of your shoulders. If you can put your arms up, your left arm up for me, please. And then if you can put it towards your chest. Thank you. And then put it towards your back. Thank you. And then go ahead and do the same on the other side for me, please. Up, front, and back. Thank you. And then if you can go ahead and just shrug your shoulder up and down for me, please. Thank you. Alright, and then I'm going to go ahead and assess for the range of motion of your wrists. If you can go ahead and flex them for me. Flex on extension, supination, oh sorry, supination, supination, and then pronation, please. Thank you. And then I'm going to go ahead and assess the range of motions of your hips. If you can go ahead and stand up for me, I'm so sorry. You're okay. Okay, if you can go ahead and go, you're going to go front, back, and then to the side for me. Thank you. And then again on the other side. Okay, thank you. If you can go ahead and touch your toes for me, please. As far as you can go. Thank you. You can go ahead and have a seat for me. Thank you. No noted difficulty with the patient's range of motion for the shoulders, wrists, or hips. I'm going to go ahead and assess the range of motion of the ankles. Okay, you can go ahead and plant up for them. And then dorsal. Let's go ahead and move them around for me like that. Thank you. Alright, I'm going to go ahead and do one more test for you. This is going to be for the deep tendon reflexes, okay? Okay. You can go ahead and just stay on your leg, no tension. Sorry. I'm going to go ahead and assess for the patellar reflexes. Okay, I'm going to go ahead and assess for the Achilles. Right here. Thank you. And then I'm going to go ahead and assess for Levinsky. Thank you. Thank you. All reflexes are normal with the patient, with the patellar, Achilles, and Babinski. Okay, your total assessment is complete. Do you have any questions for me?
No, thank you.
No? Okay, thank you so much for your time. Thank you.